moving. There is a 10 to 20 second delay. So. All right. Welcome everyone to Pennie's Community Partner Workgroup meeting for July 15th of 2022. We can't thank you enough for the privilege of your time today. Just a couple housekeeping updates here. All attendee lines are muted as we're on MS Teams Live. And please note that we have several Pennie staff here who are monitoring questions that are typed into the chat. We'll be here to help answer those questions for you. Any questions that are added to these meetings, we also produce, and we'll talk about this again here in a moment, but we also produce a Q&A document that is available on the Pennie Community Workgroup resource page. To give you an overview of what we're going to cover today, and we've got a lot of very, very good updates for you. But in addition, we're also going to be talking about some platform updates that have recently been made that are sure to help in terms of the customer experience here at Pennie. We're going to talk a little bit about annual income verification, and we're also going to talk about Social Security numbers and FAQs that are related to that process and the Pennie application. So with that, I'd like to start by going through some updates with regard to the community here at Pennie. As you may know, we are approaching open enrollment. I know it's only July, but we are approaching open enrollment 2023. And with that being said, we're already in the process of updating Pennie's broker training. Right now, the broker training for OEP 2023 is projected for mid-August launch here in 2022. An important resource here to keep in mind is the agency.pennie.com broker certification page. The link is here. The deck for this presentation with the resource links will also be posted. But please do keep an eye on this particular page if you're a broker refreshing your training for OEP 2023, or if you're a new broker. And believe me, we welcome new brokers. The same is true for our assisters here at Pennie. We are currently in the process of developing the refresher training and the new assister training here at Pennie. Those updates will be provided again on our assister resource site, which is agency.pennie.com assisters. You'll be able to view those, and under where it says get certified, a new assister is able to request their Pennie assister training through that. We are very excited about our assister training this year and the refresher training. We hope to enhance it on many levels, and I'd like to personally shout out to Karen Gage, Melissa Watson, Kyle Fix, Tia Whitaker, the folks who really help inform and help us develop this training so that it's meaningful for our sisters. With regard to community partners in terms of updates, there is a guide that's being developed right now that will help new assisters better navigate their registration process through the Pennsylvania Insurance Department, and specifically with the CIRCON platform. If you're a producer in Pennsylvania, navigating CIRCON is pretty straightforward. However, it can be a little challenging for assisters to figure out exactly where to start their application for registration as an assister. Again, a very, very special thanks to Cognosante and the Mendoza Group for creating a wonderful resource that will no doubt help so many of our newest sisters here in Pennsylvania. So with that, I also wanted to make sure that everyone was aware that we're in the process here at Pennie of enhancing our community partner website. Our community partner website can be found at pennie.com/community partners. That particular site is one that's utilized by our state partners, our county level, municipal level partners that we have, as well as hospitals, health centers, nonprofit organizations, faith-based groups. That community partner page is one that we want to be as resourceful as possible with. And down towards the bottom of that community partner resource page, there's an invitation for you to submit your name, your email address, your organization. The subject line could be an idea for improving that website. Because ultimately, we want to make sure that, yes, our brokers, our assisters are well equipped here at Pennie, but for us to truthfully impact the uninsured population in Pennsylvania and to help folks who say, I don't have insurance, we need the resources available on this site to be as supportive as possible for any of our community partners who needs to better educate, to better inform their communities, and we can help provide you with the tools and resources that you need. So if you have an idea, please don't hesitate to share it with us. Pennie, just like any other new organization, will improve in as much as we receive feedback and insights from those who we serve here in the Commonwealth. Speaking of serving the Commonwealth, Pennie's marketing and communication team, as well as many others here at Pennie, have created our annual report for 2021. And there was a lot of really, really hard work that went into this. It produced a document that, quite honestly, is very informative for anyone in the community who wants to learn more about what Pennie has done in the past couple of years, and more importantly, how we've helped the Commonwealth. And when I say how we have helped, I mean not only the folks here at Pennie, but our brokers, our assisters, our community partners like you, who have helped us protect so many. I just wanted to make sure that everyone was aware that that annual report is out and ready for review. So, and also for sharing. So please don't, don't think that you can't share it. It's something we encourage. Now, another update that I'd like to provide, our marketing and communications team here at Pennie has been working very, very hard to try and make sure that we are equipped, everyone in Pennie's community, that we're equipped with information that helps educate and connect people with Pennsylvania's health insurance exchange. One of the new pieces that we've developed was affectionately referred to as the waiting room flyer. This waiting room flyer, so to speak, is in its initial design, it was designed to help hospitals, health centers, urgent care centers with their communication of, Pennie, the services we provide, the financial assistance that's available, a little bit about qualifying life events, etc. But this particular piece is one that, from an outreach and community engagement perspective, I think is an incredibly fine piece for anyone who has a waiting room, who has educational materials set aside in their office for the people that they serve. This particular piece is one that has a lot of great information, and it provides an individual with something that they can carry at a quick glance and get, get the help that they need. So definitely we're excited about that. Another piece that we're excited about, and this was developed and designed from feedback and requests that Pennie received directly from our chambers of commerce, our small business development centers, organizations within the Commonwealth of Pennsylvania who work alongside or in a capacity of development or support with small businesses. As many of you know, Pennie doesn't provide group insurance, but for sole proprietors, for small precision manufacturers, for small business owners, and their employees, Pennie can be an option that they can consider with regard to providing health insurance and protection for themselves and their families. So we developed this piece that helps guide that discussion for small business owners, sole proprietors, and folks of that nature. So please, if you have someone in your community that you could share this information with, request some. We'll be happy to send it to you. And you can do that through our community partner website. Another very helpful document that was created was a guide for customers to designate a Pennie broker or a Pennie assister. This particular guide is beneficial for individuals that within the community who may already have a relationship with you as an assister or a broker, but they might need some help in terms of designating you as that official advocate for them. This guide can help in that process. Another important initiative that we've talked about in a couple of our previous community work groups is the public health emergency, and how many of our friends and neighbors here in the Commonwealth of Pennsylvania are currently protected under medical assistance. The Department of Human Services and Pennie have been in very strategic meetings and communications, both from a marketing and communication perspective to an operations and IT perspective through a policy perspective. Long story short, in addition to the brokers, assisters, and Pennie community partners like you who are aware of the impact that the ending of the public health emergency will have upon many of our friends and neighbors, Pennie is trying through a partnership with the Department of Human Services to expand our network of individuals who are informed, who are aware of resources that are available to help and connect people with Pennie and other resources through the community. There's a link that's provided here where you can become a helper. Now, the question's been raised, can I become a helper if I'm also a broker or a sister? Yes, you can. But more importantly, we would like you to consider sharing this link and the request that this link represents with your partners, with your network, so that we can broaden our sets of eyes, sets of ears within the community who, if individuals or families are impacted and they're not sure of what resources they need, they can connect with those resources in a very efficient way. So please do share that. Pennie has worked very, very diligently to update our glossary that we utilize in both English and Spanish, specifically to provide a better customer experience for our customers here at Pennie. Again, I need to thank Juan Valencia. I need to thank marketing and communications. I need to make sure that shout out goes out to the Mendoza group. There were a lot of our partners who contributed to this document and to our ability to make sure that the common terms, the vernacular that we were using on a very complicated subject, which is health insurance, was clear and concise. Also, I wanted to briefly mention that Pennie had the opportunity to attend the State of the Union on Latino health that was sponsored and powered by Latino Connection on June 23rd in Harrisburg. There were a lot of great takeaways from this session, from the entire event, that have helped us rethink how we approach not only communities like the Latino community, but also other underserved communities in Pennsylvania. A few of the key items that came out of that were, specific to Latinos. There's a lack of health insurance. Language barriers matter. In many cases, there's a lack of transportation, isolation, and something that was very, very important, and that's invisibility. There are a lot of individuals in communities throughout our Commonwealth who feel invisible, who feel that they have no options, that they're not recognized. Well, those are things that we're going to be mindful of with regard to our outreach, our communications here at Pennie. So it was an incredibly valuable event for us. One last thing I'd like to mention before I turn things over to my colleague Hannah is we do record these sessions. We record them as resources. We post the agendas. We make sure that the meeting deck is available and that your questions and answers are addressed and posted publicly. So please keep in mind, this Pennie Community Workgroup website is a valuable resource for everyone. So thank you again. I'm going to turn things over to Hannah. Hannah, thank you so much for joining us today.
Great, thanks, Scott. Let me go ahead to the next slide. So we wanted to give you guys some updates on some recent system enhancements. We did have a deployment earlier, actually I think it was July 1st. So first off is something that we actually talked a little bit about last month's work group, but this has now been deployed. We have deployed automated eligibility for the Medicaid and CHIP account transfers. So this is we're really excited about this improvement. What this does is for customers who've initially, their application starts with the Medicaid and CHIP agency. So maybe they first applied through Compass and then were found not eligible for Medicaid or CHIP. Medicaid or DHS will send those applications to us to determine their eligibility for Pennie. So prior to this enhancement, when we would receive those applications, we would load them, create a draft application, and send a notice to the customer saying, we've set up an application for you. Come on, log into Pennie, review the information. They would have to click through the full application to review everything, and then submit the application in order to find out if they were eligible for coverage through Pennie and with what type of financial assistance they may be eligible for. And then they would still have to go as normal, report their life event and shop for a plan. What this new functionality means is that when we get the application from information from Medicaid and CHIP, we will now skip the step where the customer has to review and click through the full application. We'll get the application, we'll submit it, and actually the first notice the customer receives from us is their notice of their eligibility for coverage through Pennie, along with any financial assistance that they may be eligible for. So then the customer then just logs in and reports their life event and shops for a plan, but their initial notice from us will now include their eligibility determination, which we're really excited about. So that has gone into production, like I said, around July 1st. And we are seeing a lot of successful customers getting their applications automatically getting their initial eligibility determination. I did want to note there are sometimes scenarios where even with this enhancement in place, where we don't have enough information to actually give them that eligibility determination. So there are still some scenarios where someone will still follow that old procedure where we will create that draft application, and the notice to them will say, hey, we need to come in and review your application, and they're going to need to fill in some of that missing information in order to find out their eligibility. But we're seeing a pretty high success rate of automated eligibility for these account transfer applications so far, so that's been really great. Along with that, there was a fix put in place where an issue we had talked about back in February, I believe it was, where sometimes when an application account transfer would come from Medicaid or CHIP, we would see certain types of income would have been dropped off of the application. That's all been fixed, and so that's if you had been experiencing that issue in the past, no longer be seeing that, and on any of the application account transfers between us and DHS. Next slide. Actually, so next one is we did make an enhancement to the low income SEP. This is for customers who are eligible, who make 150% of FPL or less. Those folks, since the beginning of this year, have had an automatic SEP where they can up to once a month change their plan. What we've kind of implemented aspects of this additional features with this SEP throughout the year. So earlier in the year, we were able to automatically grant this SEP to any new customers coming through. So when a customer submitted their eligibility application as a new customer, the system would automatically notice that, okay, they are at that 150% or less of FPL, and it would automatically approve them for this SEP, so they could immediately start shopping for a plan without having to, go in and know that this SEP is available to them. What we recently deployed was actually automation for this to be automatically granted for existing customers. So any current customer who's been enrolled with Pennie maybe for all of the year will now, when they log into their account, see on their dashboard a banner message that says, you are eligible to enroll and make a change to your plan. It is available for up to once a month, and so they will immediately see a shop for plans button on their homepage. So we're really excited to make that available to them automatically in their account. Up till now, these folks, the current customers, because it wasn't automatic, they would have to call Pennie customer service, but to get this granted. But now you'll see this immediately on their account dashboard. Next slide. Great. And then a couple of sort of back end things that we've implemented, but we think that you all will benefit from and be good to know about. So first of all, we have made an enhancement that's going to make it a lot easier for Pennie representatives to more quickly resend account activation emails for assisters. So when an assister, if you've not claimed your account yet and you can't find that initial activation link email, previous to this, our Pennie representatives had a couple of steps that they had to take before they could actually get that email resent out. So it made the process a little bit slower, but they now have the ability to do that almost immediately while you're on the phone. So we're really excited about that. It's going to be a lot faster for our sisters to, if they need a new activation email, to be able to get that. We do have that functionality for brokers. So if brokers need their activation email sent out, the representatives should be able to also do that while you all are on the phone. So we're excited about that. Also, we've, sorry, go back one more. Thanks. There's an additional feature we've added where we're going to be able to start publishing announcements that will appear on your assister and broker dashboards. So it's just we're excited. It's going to give us a new communication channel to provide information to you all for things like For example, during open enrollment, as you all know, when we get close to one of our deadline days, December 15th or January 15th, sometimes there are, if there are long wait times in our call center, or if there was any sort of technical issue right around that deadline date, sometimes we extend that deadline date by up to a week. And so we can use things like these announcements to more quickly get that information out to you all. So keep in mind, so you'll start to see those coming, I think probably as we get a little bit closer to open enrollment, but we're looking forward to using that as another way to help get quick and timely information out to you all. Okay, next one. And then our last enhancement here is, I'm very excited about it, and hopefully you all are too. So the enhancements really to help us with avoiding duplicate household creation. So you all may not, some of you may have seen this happen. Some of you may not have maybe have not experienced it, but in general, customers are expected to only have one household account on Pennie. However, there are times where customers, we'll talk about why this happens, but they can end up having more than one household record in our system. When that happens, all sorts of unexpected things happen, right? So you could, and it creates just a lot of customer abrasion, increased call volume. Sometimes it can impact their enrollments adversely. So we're trying to work to add additional layers and to help avoid these duplicate households from being created. Right now, the way that we're seeing the vast majority of these households being created, duplicate households being created, is actually by brokers and assisters. So maybe you're working with a brand new client that's new to you, but that client already has an existing household account with Pennie. And if you go and just, add, I think it's add an individual or add a customer through your assister and broker portals, not realizing that the customer already has an existing household on Pennie, that can create duplicates. And then we can have some downstream adverse impacts to those customers. So we've been focusing on how we can avoid duplicate households being created. So one of those things that we've done recently is put some new system rules in place that are going to help prevent the creation of duplicate households. So you'll notice, and then you can see in the screenshot on the right there, if you try to use through your assister or broker portal and create a new customer, you may start to see more this message about this person already exists in the system, you can't create a duplicate household. So that'll help you in case you might not realize that this person who is a new customer to you already has existing households on Pennie. We do think that there's also some things that you can do in your regular process working with new customers that can also help with avoiding creation of duplicates. So, ask the customer, have they ever applied through Pennie? Have they ever had coverage through Pennie? Did they have coverage on healthcare.gov in 2020? Remember, that was the year before we launched, but healthcare.gov migrated all of that information over to Pennie. So sometimes we've seen people who didn't think that they had a Pennie account, but they did have healthcare.gov coverage in 2020. So their information was migrated to Pennie, even if they never actually were covered through Pennie from 21 or 22. So those are the types of people who are going to already have an existing household on Pennie. So if one of those situations applies, there's a couple of different ways you can help that customer to access that existing household record instead of going and creating a duplicate. So first is, using the forgot password option when on the login screens. That would help if someone maybe had previously created an account. If they already had a login created, then they'd be able to trigger a password reset. The other option is if they really don't think they ever created an account, but maybe they worked with another assister or broker in the past or something like that, then they might not have an account, but they can actually register to create an account for that existing record using the register with access code. That option, you can still use that option even if you don't have the actual access code. Remember, you can use that option, and there's a search for your account by social security number option instead of searching by access code. So that's another good way to, if you find you're working with someone who has an existing account, but maybe never actually created a login, that would be another good pathway. And then lastly, of course, you can always call Pennie customer service with the customer, and they representatives quickly find that customer's record, use the customer's phone authorization to designate you as their assister or broker. And then from that point forward, you'll have access to their information through your portal, all without having a duplicate created and some of the downstream consequences that can come from that. Okay. Great. So the next topic we wanted to spend a little time talking about is annual income verification. So go ahead, next slide. So this is a new process that is a mid-year process where we as an exchange have to do some additional eligibility checks to re-verify people's income from their application, checking it against those trusted data sources like the Federal Data Services Hub, to make sure that customers are receiving that right amount of financial assistance, and that we, of course, all want to avoid the situation where a customer might have to repay APTC at the end on their tax return. So this mid-year process, the people who are kind of included in this check where we re-verify their income are going to be anyone who is currently eligible for APTC, and anyone who has not already resolved an income DMI in this plan year. So let's say you have a customer who in January they had applied, they received an income DMI, they provided all their documents, our team reviewed them, everything was good, signed off, and that resolved that income DMI. That person is not going to be rechecked again with the hub because we've already gone through the process of reviewing the documents with them. And so we don't need to do another check there. So we are trying to reduce the scenario where someone would have to do that again. But there are people who didn't necessarily have an income DMI in the past or whatever reason. And so we're going to do another check of their eligibility against those data hub to make sure, again, that they're getting the right amount of financial assistance. So we're currently scheduled to run this process at the end of this month. So I want to talk a little bit more about what you should expect. So go to the next slide. So what is this annual income verification process doing? So we take the household information that the customer provided on their application, and we look and compare that income information against the Federal Data Services Hub. When we do that comparison, we actually follow the same rules as when someone applies, and we are comparing the application income against the data hub when we would normally generate potentially income DMIs. So those rules are here basically when the income on the application is more than what the data sources tell us, then we don't generate a DMI. And we talked a bit about this in our May work group, but if you recall, the reason there's no DMI there is because when a customer's income that they're reporting is more than what the data sources tell us, they're less at risk for potentially owing back tax credits. In a situation where someone would have a tax penalty at the end of the year would be when someone's application has less income than what those data sources tell us. So that's when we do the comparison, and we do have some pretty generous thresholds for comparing the differences there. But if the difference is beyond those thresholds, then we will generate, in this case, we'll generate an annual income verification DMI if the information doesn't align. So it's going to be a new type of DMI, it's the annual income verification DMI. And it's going to have customers have 30 days to resolve that through the reasonable opportunity period. What's a little bit different than some of the other DMIs or things that you've done in the past is there's not actually going to be any adverse action taken after the end of the reasonable opportunity period. So their coverage, we're not terminating their coverage and we're not terminating their financial assistance. So why would a customer who did not previously have an income DMI when they applied earlier in the year now end up with a discrepancy that would now generate an income DMI, especially since we're using the same comparison rules that we would do under the normal income DMI rules. And the real answer is because the data that the Federal Data Hub has changes regularly. So it could be anything from IRS data has now been updated because they've processed, recent tax returns. In addition to the IRS data, we also use credit bureau data that's constantly updating. So even if the customer's application information has changed, the thing that we're comparing against, those data sources, may have become updated and have more recent data. Okay. Next one. So what this is going to look like when you go into a customer's application, on that document and verifications page where you would normally see any DMIs, you're going to see now a new DMI type, basically, which is the annual income verification. I've shown you both ways, with it being verified or with it being not verified and having a deadline date. You'll see that that is separate from the regular income DMI. So while we are checking the same thing, the actions, the timeline, the amount of time they have to resolve it, as well as the adverse action that happens, is different between those two. So that's why you're going to see them as separate. If a customer does get an annual income verification DMI, they will of course get a notice. We always get notices. We have an excerpt of that notice here. The first line in bold, that's what you would see as the subject line. And then, it explains the 30-day period of time. And that what we really want customers to be doing here is to go in and just make sure that that income update information is as up to date as possible. Okay. Next slide. So recently in April and May, I think, we did a periodic data matching and PDM. And this process is pretty similar to PDM in that we are doing additional eligibility checks beyond the checks that we do when someone submits their application. But there's some differences here. So for example, the income verification, this annual income verification, we of course are only checking income here, whereas on PDM we were checking non-ESI MEC, that's things like Medicaid, Medicare, TRICARE, things like that, and death. So we're checking different aspects of eligibility between PDM and the AIV. And of course, the other very big difference is that with PDM, if those DMIs were not resolved by the end of that 30-day reasonable opportunity period, we actually terminated their coverage. But with the annual income verifications, if that's not resolved, it's not going to be any adverse impact to their enrollment or their financial assistance. So the big question, of course, is then why should customers really resolve these annual income verification DMIs if there's no adverse action? Fundamentally, this is about making sure that customers are getting the right amount of APTC based on their expected income, and that we are minimizing their potential tax liability at the end of the year. So if it's a great opportunity and a great reminder that for them to go back and look at their income, maybe their expected income is different now than when they've previously applied, and they haven't updated it yet. And it's just this process kind of flagged that for them. The other thing to remember is that, as we talked about a lot in our in June work group meeting, the way that Pennie calculates APTC is on this annual basis. So when customers do need to make a change to their income mid-year, we're going to look again at their APTC eligibility for the rest of the year, take into account how much APTC they've already used. And the later we need customers to keep their income updated as soon as possible, because if we kind of wait too late in the year, the customer may have already at that point received too much APTC and there's nothing we can do about it. But if they report their income change now, even if they're actually going to be eligible for less APTC, there's still time in the year that they probably haven't exceeded their annual amount yet. So it's really good to use this opportunity to also just verifying that that income is updated and as recent as possible. Okay. And then we can go ahead and go to the next section, which is actually, I'm going to hand it over, I think, to David Thompson, our Director of Policy.
Yep, thanks, Hannah. So I know there's been a lot of questions about Social Security numbers and who is required to input those in the Pennie application and other questions. So this section, we aim to answer those questions and hopefully provide some clarity around this issue. So first, who is required to provide a Social Security number on the Pennie application? Any member of a household applying for coverage who has an SSN is required by law to provide it, and we are required to collect it. Adults in the household who are not seeking coverage and who have an SSN, if applying for financial assistance, are also required to provide the SSN if they have one. The reason being is that if to verify eligibility for financial assistance, we need to check the Federal Data Services Hub to verify income, and if there is a data mismatch with the SSN not being provided, then a DMI will be created. Who is not required to provide an SSN? So any member of the household without a Social Security number is not required to provide one, and they should leave that field blank. This includes those who recently applied for but have not yet received a Social Security number. We recommend that people apply for a Social Security number and then update their application when they receive their Social Security number, but they should not wait for the Social Security number in order to continue through their Pennie application. Children in the household who are not seeking coverage and who have an SSN do not have to provide one. However, just as a general rule, we strongly recommend that anyone with a Social Security number provide it on their Pennie application in the event that the child wants to seek coverage later, or the household wants to apply for financial assistance. It's just better that everyone provides an SSN if they have one for ease of applying and enrolling in coverage. So what happens if a customer who has a Social Security number and meets one of the criterias above does not provide it on their Pennie application? So they'll have, what will happen is they'll be conditionally eligible for coverage for Pennie. And even if it's an adult not seeking coverage who has an SSN and they're applying for financial assistance, an SSN DMI that is not verified within the 90-day reasonable opportunity period will result in the termination of coverage. So they won't just lose eligibility for APTC, they'll lose eligibility for coverage altogether. So that's one. And then customers may receive a Social Security DMI if they provide their SSN, but the application information does not match what the Social Security Administration has in their database. So examples can include a name mismatch, date of birth mismatch, and death status. So it's very important that applicants provide their information exactly as it is on their Social Security card so that their information can be verified. Next slide. So who is likely to have a Social Security number? U.S. citizens and U.S. nationals should have a Social Security number. Legal permanent residents, LPR, or green card holders will also generally have a Social Security number. Most lawfully present non-U.S. citizens will have one as well, but some may not. Whether it's because they recently gained lawfully present status, or they've applied for one and are waiting for it, they might not. So in those instances, it's possible that they don't have a Social Security number. So the next question is, can individuals without a Social Security number apply for coverage through Pennie? And the answer is yes. Individuals without a Social Security number can apply. all individuals who leave that field blank will be prompted to provide a social security number. Anyone applying for, anyone going through the application will be prompted to provide a social security number if they have one. Individuals without one should leave that field blank, regardless of if they have a taxpayer identification number, an alien number, any other number. They should not try to input that in the social security number field. They will need to provide other information demonstrating their lawful presence and eligibility for coverage through Pennie later in the application. And that prompt is displayed on the slide. So what this shows is someone indicating that they're not a citizen, don't have a social security number, then they'll need to check that they have an eligible immigration status. When they do that, they'll be prompted to select the document that proves that they are lawfully present and therefore eligible to enroll in coverage through Pennie. And then they'll be prompted to enter specific numbers that are on that on that document to verify their status. If it's unclear exactly, what number is being referred to, the application includes information on what those numbers should look like. So, for instance, an alien number is 9 numerical digits. A card number for a green card holder is 13 characters, the first 3 being alphabetical and the last 10 being numeric. So, we try to make it as clear as possible what document numbers an individual is required to provide. Next slide. So there's also a little bit of confusion around, the difference between a social security number and individual taxpayer identification number. An I-10 is a number that some lawfully present immigrants without a social security number may have instead. The IRS created this in 1996 so that more working immigrants could file their taxes in the United States. And it's really only used for tax purposes only. It is not a valid identification number to apply for marketplace coverage. The I-10 is a 9-digit number that's formatted like a social security number, but starts with the number 9. If you try to input it in the social security field on the Pennie application, you will not be able to. It will reject any number that starts with 9. And so with someone who does not have a social security number, even if they have an I-10, should still leave the SSN field blank. We cannot accept the I-10, and there's nowhere to input it throughout the Pennie application. Those without an SSN or any non-citizen, when you're working with somebody, you should remind them to come to an appointment, or when they start their application, remind them to have kind of all those documents with them so that they can input those numbers directly and be able to move through the process smoothly. Next slide. I think I'm handing this back to Scott.
Yeah, thanks so much, David. That was fantastic information. And Hannah, thank you as well. While we have some time, are there any questions that have been submitted in the chat that you'd like to call out?
Hey, Scott, this is Hannah. I think we got a recent question on this SSN topic that maybe, David, you could address. The question is about I-10s and if that's the same thing as a green card.
So a green card is a specific document that demonstrates that someone is a lawful permanent resident. An I-10 is something is is a number that's used purely for taxpayer services. So an ITIN won't necessarily indicate that someone is a green card holder. It'll just allow them to pay U.S. taxes. A lot of undocumented immigrants will have an ITIN, and of course, undocumented immigrants are not eligible for coverage through Pennie. So on the slide previous, the example that that's displayed, next slide before, is an example of how the application displays the numbers required for green card holders to verify that they do in fact have a green card, and those are the alien number, card number, and then the expiration date of the green card.
All right, fantastic. Thank you so much, David. Julie and Hannah, were there any other questions that came up?
Yep, we got a couple of questions in the chat that we've put about the annual income verification and whether people who maybe had previous income DMI and resolved it with the attestation form, if they would be considered part of the annual income verification process. And the answer is no. Anyone who had an income DMI that they resolved by providing their documents anytime in 2022, those folks would not be considered part of the annual income verification process. They're not going to be included in that check. So whether they resolved that income DMI using pay stubs and W-2s and other, what other types of documents or an attestation form, either way, as long as that income DMI was successfully resolved through documentation that was provided, they would not be included in the annual income verification process. Now, if the person had a 2021 income DMI that they resolved, but that in of itself does not exclude them from this annual income verification. So it would only be any 2022 income DMIs that were resolved that would maybe exclude them from this process.
All right. Thanks so much, Hannah. And everyone, just as a reminder, again, we will post the recording of this session to be utilized as a resource. We'll also make sure that a copy of this deck is shared along with the resource links. And any of the questions or answers that came in that we weren't able to get to during today's session, we'll make sure that those responses are posted as a resource as well. Again, we can't thank you enough for the privilege of your time today. Just as a reminder, any community partner who encounters someone who is uninsured or who's in transition, who's looking for health insurance options, you can refer them Monday through Friday, 8 a.m. to 6 p.m. to 844-844-8040. If you're a broker or a sister who needs help, you can contact that 844-844-4440 number, or you can email us at brokers@pennie.com or sisters@pennie.com. And with that being said, Hannah, Julian, if there are no further questions, please do keep your eyes open. We will have this information posted very soon. And thank you again for your time. Everyone, have a peaceful day.